Okay, good morning. This is the Board of County Commissioners Board Work Session. It is Thursday, June 2nd, 2022. It is 9:32 a.m. This is a hybrid meeting. We're in Building 1, 280. Ramiro, is there a phone number for this?
No, we're no longer using a phone number, ma'am.
Okay. So the topic of today's agenda is the Treatment Sales Tax 2021 Annual Report. And I believe no introductions are needed, so County Manager, I'll hand it off to you.
Okay, Madam Chair, this is a yearly briefing to the board related to all the great work the treatment sales tax does on a yearly basis. And that board has been involved in many conversations related to this particular funding. One during the budget process last fall, and here recently related to the community grants. So what you will hear today from Carrie and her team is a snapshot of 2021. So go ahead, Carrie.
Good morning, Commissioners. Carrie Hennon, Public Health and Social Services. And yes, I like the word snapshot. So lots and lots of funding and programs through TST, and what we'll provide today is really kind of just some highlights, a little bit pulling back to a little bit more of that 30,000 foot level rather than being really detailed like some of our more recent conversations. I think you all have now met Shaylin Begornia, who is the treatment sales tax data analyst, so she'll be helping me with the presentation, and you should have the 2021 annual report hopefully in front of you. And can I also share my screen?
Okay.
Okay. Okay. As you know, TST is local funding supporting mental health and substance use disorder treatment and related services. And as I think you also know, we do collect quite a bit of data to try to get a handle on what exactly did the county support and did it have any impact? What were kind of the results for the community members who received services funded through the treatment sales tax? So again, we'll provide kind of a snapshot and some highlights today. So in 2021, the revenue from TST was almost $7.8 million. That's a big number, bigger number than we expected. That, like some of your other sales tax, has really increased pretty considerably in recent years. Spending was about $6.5 million. That's a smaller number than we anticipated. So our fund balance did grow, and you did see the TST financial plan recently. Quite a bit of underspending was related to the pandemic and a lot of kind of staff turnover in programs for some reasons that you've heard about in other places. So positions unfilled, et cetera, led to some underspending. TST funded programs served about 3,800 people. We do unfortunately have a little asterisk next to that number because we are not able to completely deduplicate. There may be people who accessed more than one TST funded program that we're not able to deduplicate. These first charts give you sort of an overview of the kind of demographics of who was served in 2021. So we do collect data on race and ethnicity. And so with respect to race, about 67% of participants identified as white, but I would note that we do have 7% we were missing data for, 5% categorized as other races. And then you can kind of see the breakdown across multiple races: Native Hawaiian, Pacific Islander, American Indian, Alaska Native, Asian, and Black and African American. Again, we do collect data on ethnicity. And again, we do have some kind of holes in the data, so it's not that easy to compare to kind of overall Thurston County numbers, but we're working on that, and I think getting better every year. And those numbers came in at 76% non-Hispanic, non-Latino, 8% Hispanic, Latino, and then 14% where we didn't have information. We collect some zip code data. 15% of participants were kind of classified in the data as homeless. I believe that could be an undercount, and then you can kind of see the breakdown across zip codes, which are pretty concentrated in the more urban areas in Thurston County. 61% of participants identified as male. As you know, TST funds a lot of programs in the criminal legal system, so that probably accounts for a pretty disproportionate kind of a skew toward the male participants. And then you see a bit of an age breakdown. The bulk of participants are in this 25 to 54, age 25 to 54. But you'll see that we do serve quite a lot of children and young adults as well. Okay, big long laundry list of all the wonderful things treatment sales tax funded. We try to just sort of show this list as in a couple different categories. So we have our treatment courts, which spent in total about $1.5 million in 2021. We have a lot of different youth and family programs, which spent a bit more than $2 million. Adult programs other than the treatment courts came in at about $2.2 million. And then our community grants were at about $300,000 in 2021. With the increase the board allocated this year, you'll see much more spending for that in 2022. And then admin and also some training costs and indirect costs got rolled into there. So coming in at about $400,000. So the rest of the next several pages of this report are organized sort of according to these categories, and again, provide just some kind of high level snapshot data. So Shaylin's gonna help us walk through those highlights, and we will start with the treatment courts.
Thank you, Carrie. All right, so for treatment courts, client numbers were lower in 2021. The COVID-19 backlog has played a pretty large role in this, and it's also contributed to lower rates of participation in these programs. We selected a few program performance measures to show in this report, but not all of them are shown here. We do collect more data and try to get a sense of how well and also is anyone better off. So for example, for drug court, we had 71 new clients that were referred, 38 new clients enrolled, and 75% was the graduation rate. And lots of TST programs did great things in 2021, and a few examples of just a few significant program changes for mental health and veterans court. They revamped the referral and acceptance process. So this reduced the time from referral to entry from 2 to 6 months to 10 to 14 days. And they also widened the nexus between legal problems and mental health issues. So this allowed higher needs participants to enter the program. They also assigned a care coordinator to clients as soon as they're accepted into the program instead of waiting for legal documents to be finalized. And last but not least, in the past for mental health and veterans court, only those with a negative urinalysis or UA were allowed to enter the program, but UAs provide valuable information to develop treatment plans. So they began allowing participants to enter with a positive UA. And for youth and family programs, clients served remained pretty steady for most programs like nurse family partnership or equine assisted youth peer support, but for youth outpatient treatment, which is on the far right side of that bar chart, which tends to be school-based, you can see a pronounced decline. For wraparound with intensive services and children's mobile crisis, which is more towards the left side of the bar chart, clients served did go up in 2021. And furthermore, just to kind of highlight a program measure for children's mobile crisis, they saw 81% of their clients exit to successful case closure or ongoing treatment, and that is 302 successful exits out of 373. And there were also some big changes in youth and family programming in 2021, and two of those changes included clinical mental health services being transitioned from the Thurston County Juvenile Detention to Catholic Community Services, Mobile Crisis Juvenile Justice Program. So that Juvenile Justice Program replaced the Juvenile Court and Detentions Transitions Program, and this integrated 24/7 children's crisis services into detention, which really helps ensure continuity with after-hours services and also allows stabilization services for 60 days beyond the initial intervention provided in detention. And also a new program called Family Intervention Nurse, or FIN, was launched, and this provides nurse home visiting services for families with behavioral health needs who aren't eligible for nurse family partnership. And for our TST-funded adult programs, which operate mostly out of the Thurston County Corrections, overall client served numbers were down in 2021, except for reentry assistance and pretrial release, which increased slightly since 2020. And furthermore, just to give another snapshot of one of our program performance measures for reentry assistance, they linked 89% of their clients to treatment, and that's 117 out of 131. And then 31% were linked to housing at exit, so that's 41 out of 131. And as mentioned earlier, these programs operate out of the Thurston County Jail. And so challenges with COVID-19 were especially intense due to the congregate setting. And so to comply with public health guidance, the Thurston County Jail switched to virtual programming for most of the TST funded services. And this allowed most of the programs to continue providing services throughout the year, even as outbreaks occurred. And a new program in 2021 used TST funding to cover the cost of court-ordered psych medications for individuals involved in competency restoration proceedings. So it's hoped that this funding that will facilitate timely competency restoration, excuse me. And then for our other adult programs, we saw that clients served increased in 2021 for most of them. For housing case management, they placed 201 individuals into housing. And then for intensive services probation counselor, 69% of those individuals were engaged in treatment, and that's 136 out of 196 individuals. And with new TST funding in 2021, the Thurston County Public Defense created a social services position. And this program actually launched in the spring and was able to assist 88 defendants during the year with connections to needed services, and 64 individuals were referred to behavioral health treatment. This program has been doing a really great job of building partnerships with other programs as well, including the treatment courts, programs in the Thurston County Jail, and other housing providers.
All right, thanks, Shaylin. I think we may have now just demonstrated why you created an advisory committee to dive a little deeper on the many, many, many programs. And, you know, again, this just sort of scratches the surface of all the data we collect. We do have a online dashboard available. It's publicly available, but used by the advisory committee members so that as they kind of hear from programs, hear program presentations, they can see the full array of performance measures. They can see changes over time. And it's a lot to digest, but again, that's the benefit of having that group of people who are able to spend a little more time talking to programs, hearing about programs, etc. And let's see, the last page of this, we once again thank the advisory committee members who do put in a lot of time doing all of this. And hopefully some of this looks familiar to you. So under accomplishments, we listed the advisory committee did develop a recommendation to you all about the biennial budget 2022-2023, and the board adopted most of those recommendations, which creates some new programs that are rolling out currently in 2022. Other activities underway, new members of the advisory committee. The work of the advisory committee this year, because you all aren't building a budget and so they aren't developing a budget recommendation, really is talking to programs and having a little bit more time for those conversations. So we're kind of hosting a series of meetings this year where in March, for example, all the treatment courts came in and talked to the advisory committee, and we got to look at their data. In jail, we talked to all of it, or in April, we talked to all the jail programs. So they're getting to kind of know the programs a bit better. Other activities this year, RFP process for TST community grants. You all just worked on that. Supporting the launch of the new TST funded programs that are rolling out. And then working to support existing programs on diversity, equity, and inclusion goals. So the advisory committee often asks programs receiving TST funding, hey, what are you doing in this world related to DEI? How are you meeting the needs of a more diverse population? And working with those programs, and Nicole Miller has been part of these conversations on asking each program to really sort of prioritize and identify, hey, what's one really concrete, specific thing you could do this year? Is it training? Is it looking at your data in a different way? That kind of thing. So a lot of conversations related to that. So probably not often that you get a board briefing where you don't have to make any decisions, informational only. You probably like seeing that box checked, but I am happy to take any questions, and I think, stop sharing probably.
Yes, thank you, Carrie. Okay, questions. Commissioner Edwards, we'll start with you.
Some time back, I think we used money from TST as maybe seed money for the LEAD program, and then we got other funding elsewhere to backfill that. So is that a common activity? Do we try to do that once in a while where we utilize our money and try to get by with spending less of ours and more of somebody else's along with it so that we can maybe do more?
They got little arrows showing that, Commissioner. The leveraging on each page, they've got a little how much they leverage to other people's money.
Oh yeah, do you have a total? That's what I was wondering about. Do you have a total amount?
We could come up with a total amount. I don't have one off. Yeah.
Stop, because I knew we did that. I wondered how much of it we were doing. That's all.
So I think what you're talking about is the best case scenario, and we definitely try to do that. And unfortunately, it can also work the other way as well, right? Where external resources are used to develop a new program, and then sometimes those are time limited, and some of those programs end up coming back to TST to ask for ongoing funding. I suspect you will see some future requests for that in your next budget process a year from now. With LEAD specifically, we have set aside treatment sales tax funding. We have not actually spent any TST funding on that yet. So in 2021, you did set aside TST funding. It turned out that the resources coming in from the Healthcare Authority were adequate to fully support the launch of that program. But that could be one. I believe that contract from the Healthcare Authority goes through June 2023. So that may be one that ends up working the other way, where we have TST set aside right now. We haven't needed to spend it, but eventually it is expected that the state support for that program will run out. And I think there could be a need for TST to sustain that in the future. So it works both ways, but yes, ideally we could start something with TST and hand it off to another funder.
No, good report. Lots of good information.
Commissioner Menser, questions?
Yeah, so just on that point, I thought that grant had a 25% local match requirement. So how is it that you said that the Healthcare Authority fully covered it?
So I think in the current year, there is no longer a match requirement. And in previous years, and so I'm not managing the contract with the Healthcare Authority, so I probably should be careful what I say, but I believe that public health has been able to, was able to identify other sources of match that so the ASO and OHRS, some of what they were providing in kind, I believe was able to be counted as match, but that's probably a question for Marianne O'Garo as the manager of that contract.
Okay. On page 6, I had a question about the jail behavioral health program.
Okay.
So I guess 2 questions. One is there's nothing there for 2019. And so did we just not have that? That's one question. And then the reduction, I mean, I know that when the board allocates funding, sometimes it takes a long time to classify positions and get people hired and get people launched. But I thought we doubled. I actually have a note written on my desk so I don't forget to tell people in the community, we've doubled the amount of capacity for that program. So I'm wondering how we got less people served in 2021.
Okay, lots of good questions. So I will say one of the confusing things in communicating about TST is how we sometimes change the names of our programs, change the provider related to our programs, and then the funding picture from other funders can change over time. So back in 2019 and before, TST was providing support for in-jail mental health services. It was a different provider. We called it MIO, the Mentally Ill Offender Program.
Okay.
That name sort of became a little bit passé, so we did rename it. Those services were provided through a different provider, and so kind of the data collection, funding, et cetera, changed. So it's not comparable, so we're not going back to 2019 for that. And then a few other things changed as well. So again, I have to make sure I get this correct, that when the BHO became an ASO, I believe they lost quite a bit of state support that they were using to augment the TST funding to provide in-jail mental health services. They still get some, but I think they're down to, it's quite a bit less than it was. So TST did have a really big increase in in-jail mental health services. I think that probably happened in 2020. And then in terms of, well, why do we see this decrease in number of people served? So any program in the jail, there were fewer inmates in 2021, 2020 and 2021 compared to previously because of COVID, booking restrictions, et cetera. And to the extent that service providers had trouble filling positions and keeping positions filled, as you might imagine, that was even more of a challenge in the jail. So these services are provided by OHRS, Olympic Health and Recovery. They did have some staff vacancies on their jail team in 2021. Hard to keep staff in the mental health field in general right now, and then working in a jail environment with outbreaks going on during COVID, I think was hard to keep fully staffed all year. Does that answer your question?
It kind of does. Is there anything about, like, is that number telling the story? Meaning, is it like, could some of the additional capacity mean we'll be able to provide more intensive services to the same number of people versus just counting how many people got touched? You know what I mean? So could this not really be telling the whole story because we provided better service to the 596? Or is it really the same level of service? We're just trying to reach more people. I mean, I don't know how many people, there's only so many people in the jail with a mental health issue. I mean, I know it's a lot, but it's not, the number is not just going to keep going up infinitely. There's only, 400 people in the jail, and if 45%, I've heard that number in the past, so that's like, we really need to be serving 200 and some people, and then we need to be serving them better, and more intensively to the extent that they have to be there at all.
Right, and so part of the additional capacity when, as you said, TST put more funding into the in-jail mental health services was to allow basically better services. So instead of, in the past, it was sort of just crisis work, suicide clears, like very acute crisis intervention, and there's now a therapist position to be able to provide a little bit more, not the crisis of this moment, but a little bit more kind of therapeutic work. Again, with COVID outbreaks, staffing issues, the ability to consistently provide that was a bit up and down. But yes, it wasn't just more money to do the same thing. There was also an expansion of kind of the scope.
Okay, and then, I think that pretty much covers what I was trying. I just want to make sure, I want to make sure that the money we allocated is, having an effect in terms of greater service in the jail. And this number may not be the number I care about. It may be about a deeper level of treatment that folks are able to access. But if this number should concern me, then I want to know about that.
I mean, I do think there's a couple things going on, because there is also simply, it took more TST funding just to sustain what already existed in the jail because of the loss in 2020 of some state funds that were supporting in-jail services.
And based on those factors that you've outlined about vacancies and jail numbers, we can expect the current level of funding to increase those numbers in 2022, for example, probably.
Yes.
Yeah. Okay. Thank you.
Thank you. Carrie, my question is in regards to the page 2, which is the summary, and where you kind of do the overview of the community members served. And my question is that something, how is that data collected? Is it the programs that we fund, is it them reporting back on this? Yes, so.
Yes. So every program receiving TST funding has a series of performance measures. We try to have some consistency across the programs, but we fund an array of really different programs. So they are kind of unique based on what are the goals of that program. But then at the end of the year, we ask them to deduplicate everyone that they served and tell us a little bit about the demographic information for those people. So we're getting that kind of in an aggregate, but from each TST funded program.
Okay. So my next question is in regards to kind of the goals, which is, support TST funded programs in identifying and advancing diversity, equity, and inclusion goals. And just with the summary, is that kind of, with that goal in mind, is that, with the summary, is that where we want to be at? Is it something that we want to better in the future? How does that goal intersect with kind of the summary that we're getting back and the data that we're collecting back from these programs?
So I think what we learn is that different programs are kind of in very different places in terms of the population they're serving, the kind of experiences of staff in serving like kind of a diverse group of community members. We have been able to dive into the data a little bit more, kind of pull out for, okay, if we look at just the jail programs, how does the population receiving TST funded services compare demographically to the overall jail population? I think we're still learning. I think we're still figuring things out for sure. And in this type of DEI discussion, we will always be learning. I think with a little better data and a lot more conversation within programs and a lot of discussion about kind of training and what are our goals and what are the problems we're trying to solve anyway, and Nicole's participation, I think it's moving in a good direction, and I think it's still a developmental process for sure. Does that help?
No, I was just didn't mean to put you in a spot. I know it was a loaded question, so thank you. Okay, any additional comments, questions?
No, ma'am.
Okay, we are adjourned. Thank you so much.
5 minutes for the next meeting, Madam Chair.
Okay, so 5 minutes. So we'll start at 10.
And also before you adjourn, follow-up question to Commissioner Edwards. You're going to come back with a cumulative leveraging, how much leverage funds will be, right?
Yep.
It doesn't need to
Yes.
be an exact amount at all. I was just curious what kind of a benefit we were getting.
Right.
Yes, we can come up with that. We do ask programs to report on that. So
Thank you.
that should be pretty easy to tally up. Thank you.
Thank you. Okay, we're adjourned.